Well, hey everybody, and welcome back to Bottomless Coffee with Jerome. As you know, on this show, we have great conversations that leave us feeling inspired and empowered to make the world around us just a little bit better. And today, we are talking with Kelly Robinson of Messianic Care about her continued work on COVID-19 vaccinations, reducing health disparities in our communities, living a healthy life, and all of the wonderful things that she's accomplished over the last 6 or so months since we last spoke. How are you, Kelly?
I'm doing well. Thank you so much.
Thank you. You really light up the room when you walk in, and so I'm excited by all this good energy that we've got between us today.
Thank you.
Now, when we last spoke, you were working with Black Nurses Rock for the Shots in the Shop program at Wilson's Image Barbers and Stylists. Is that right? Now, how did that go?
It went very well. We actually were able to do close to 2,000
That's incredible.
shots.
Yes.
At the barbershop. Yeah.
That's beautiful.
Mhm.
That's beautiful. I think there was a big bus that was involved
Yeah.
at the time. And it was an uphill climb because these were like deep, intentional conversations that you really had to have with people. Because as I'm recalling, there was like a deep-seated sense of vaccine hesitancy, but it was less about, and I'm putting words in your mouth, so stop me if I get it wrong. It was less about like a distrust and more like you haven't really talked to me about it.
That's exactly right. Absolutely. They wanted to have conversations.
Yeah.
As a people, we've been ignored on so many fronts. And so this was one where don't shove it at me.
Yeah.
Talk to me, tell me, and make it clear so that I know what I'm doing to the best of our ability.
Yes.
And everyone was, of course, under that same umbrella of the unknown.
Yeah.
But our people were, quite hesitant, for sure.
That was a few months ago. And things have changed in the world. Since then, I know you went on a lovely trip just recently on an international flight. Did you wear a mask?
Of course.
Okay.
It doesn't matter what the world is doing. It's like, yes. As a matter of fact, it was another country that had very high expectations of continued COVID protocol.
Oh, okay.
Yeah.
So would you say that the pandemic is over?
Absolutely not.
No. Okay. Okay.
Well, let's say this.
Yeah.
Because when we talk about pandemic, we're talking about what it is in the world,
Yeah.
When we talk about COVID and we put it in the same category as other viruses, the flu and everything else, the RSV that we're seeing, it is now among that group. So pandemic over, I would say we're close. It's hard to verbalize it because there's an influx of cases, and we're experiencing that now. But it's not top news anymore because we've experienced for such a long time, that it is just a part of the norm, which is sad.
That is sad.
Yeah.
I mean, like I feel like I should probably be wearing masks in the grocery store. But that would probably be seen as someone who's taking too many precautions for something that's not a big deal. And I think that thinking is just wrong. It's just too early for that.
We have to be comfortable in knowing personally where we stand with our health. Yeah. And respect those who are compromised. Yes. And that goes both ways. You don't want to give someone, because the unknown is just so out there. It's like we're sitting here and we're talking. I just came from a trip, and even though I mask, there were certain situations that I couldn't control. I don't know for sure. Yeah. But I feel good,
Well, I took a trip as well, and I was wearing a mask, and my neighbor was wearing a mask, and I talked about this on the show. That man, 16A, took his mask down and sneezed right next to me, and I was like, "Oh, wow! How could you do that to me?"
Yeah, took his
and
mask
so I got COVID from that. And so,
Oh,
but you never know how it's going to affect you
you don't.
either.
That's right.
So there are still people who've done the matrix thing and they've been
Hmm.
dodging COVID this whole time. But the flu is also no joke.
Absolutely.
I have a coworker who's been working from home for what's 2 weeks now from what was not COVID, but seemed to be some kind of bad cold. But I'm like, girl,
Hmm.
that's
Yeah. 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 It's alarming
yeah,
to note that a cold is not a cold anymore.
yeah.
You know?
Now, okay, so shots in the shop is over,
Yes,
but vaccines are still needed because we have the
that's right.
boosters.
Yes.
So I guess one, did the boosters are they making any difference? Because I'm hearing that no one's getting the boosters.
So most people have decided that enough is enough,
Okay,
unfortunately.
and that's just they just made the decision.
They made it on their own,
I'll
you
risk it.
know? Yeah, yeah.
Okay.
And because there's a lot that we really don't know.
Hmm,
And the key is, how do we determine what one dose is to sustain us
yeah,
over time? That's the challenge.
yeah.
And I'm happy to say that the most recent booster has the components that will fight exactly what's out there now.
Oh, that's good.
And so that's the key. It's like riding the bicycle and, putting the spokes on
Yeah,
while you're riding. And
yeah.
that's what we've been doing through this whole pandemic. And so now that we've identified through testing, because people don't realize, I have friends who, said, "Oh yeah, I did the 15-minute,
Hmm.
rapid
Yeah,
test and it came
swapping
back
those.
positive."
Oh,
But they did not go to get the PCR, and that's where the reporting is.
oh, yeah. No one's doing that for
I
sure.
know, I know, I know, right? But that's a part of how we determined what's out there.
Yeah.
And so for those who did, yay, because that helps what we call a very treasured thing, science,
Yes.
you
Yes.
know?
Yes.
And so the science says B4, B5. That's what we're seeing across the board. Let's make a
Gotcha.
vaccine that will attack that.
Gotcha.
And so that's the latest.
Okay.
So it's a bivalent.
Yes. Bye. I get that.
Yeah, 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 yeah. So
They're working.
they are,
I know it's limited data. One, because people aren't submitting their tests, like you
that's
say,
correct.
and so then
Hmm.
you don't know who has gotten the booster and then gotten infected, and then submit. Then they have to submit a test as well. So that I can see that being a challenge.
Yeah,
Yeah.
yeah. And it's a lot because everyone's overwhelmed,
Yeah.
with all of the eligibility that we went through and all the different vaccines, and even those of us who are delivering,
Mm,
it's like, okay, now we've got mono and bivalent,
yeah.
and who gets what at what time. And
Yeah.
yeah, so that's been
That
challenging.
is tough because I was at Johnson and Johnson
Uh-huh.
first, which was apparently I was just lucky to survive that. And then
Yep, yep. But you did.
I did, I did.
Thank
And
God.
then I've gotten I think one booster
Uh-huh.
since then. I probably due for another booster
Yep.
because what happens? I got COVID,
Okay.
and then
You
so I got
waited.
the one shot in one, and a
Uh-huh.
booster, positive infection, and then
Uh-huh.
they're like, wait a couple of months
Yeah.
before you get another booster. And I
Yeah.
think that's confusing information. I think they should just be like, just get your shots on time, period. I think that would be an
Well,
easier message.
it may be easier,
Yeah.
but it can be challenging with what the response will be.
Oh, okay.
Yes, because remember, what we've created is a vaccine that fights COVID.
Yeah.
So if you've just had COVID, then those antibodies are still vibrant.
Okay.
And if you put the vaccine in, it's going to go, woo, COVID, let's fight.
Oh,
So
really?
you will feel the fight.
Okay.
So that's why they say wait.
I took the advice. You know what
Yes,
I mean?
yes,
I was like, the
yes,
experts know.
yes,
I'm just a
yes.
talk to host. Let me do what they tell me to do.
That's
Let me
right.
call Callie.
Yes, that's right. I tell you, my DM is, I get all kinds of stuff. But but that's the rationale.
Okay.
We're waiting just a period of time. If you're not symptomatic, then you will probably be okay if you went on and got it.
Okay.
But if you are, and even if those symptoms are minor,
Yeah.
you will feel the vaccine fighting for you.
Gotcha.
because COVID is present, and
Gotcha.
so it attacks it. Yeah.
Thank you.
You're welcome.
Keep learning.
Yeah.
Yeah. Okay. So you, at Messianic Care,
Uh-huh.
had been at Tito's shop. That program ended.
Mhm.
So now what are you up to?
So that ended in July.
Yes.
And simultaneously, we started to embark onto more of the people experiencing homelessness environment.
Oh, okay.
Yeah.
We might need to add some time to this episode if we're going to be talking about that in Minneapolis. Yeah.
And St. Paul.
So how are you helping?
So
You're so good.
No, there's a team. You know what I mean? You and I are talking, but we're talking about a team of nurses and security and administrative folks that were willing, because not everyone has a pleasant experience.
That's true.
You know, in that environment.
The unpleasant experiences are what make the paper.
Yeah. So we started back in, I believe, March.
Okay.
You know, with one. And then we added a few more. One, yeah. And so, you know, we've added, and we were up to about 10 different sites.
Wow.
You know, in Minneapolis and St. Paul.
Okay.
Maintaining more consistency with the larger Dorothy Day, and then the higher ground, and then more in the last 6 months, the Salvation Army.
So what are you doing?
Yeah, so we're showing up with a little love, you know,
that's lovely. Yeah.
people that look like the people that are there.
Yeah.
And good conversation and listening, really and truly, a lot of listening.
So is it nursing, or is it more like the navigating from like the 20s? I remember Minneapolis set up like this navigation center.
Yeah.
Previously.
Yeah.
Is it more work like that, or is it health related work?
So
is it all of the above?
It's all of the above, packaged with some cultural little idiosyncratic things that we enjoy.
Yeah.
You know, like Soul Town. You know, we turn Sirius XM on, and you got Marvin Gaye in the background. Yeah. It takes our folks back. So regardless of them experiencing homelessness, they're like, oh, you know, my mom used to play that on Saturday morning. You know, and so it's just a peak of what they experience, and then they start talking about it. We've had some folks dancing and singing. I almost took a mic one time, you know. Yeah, because and we're talking whether we're on the street at Dorothy Day or whether we're in the chapel at the Salvation Army. You know, it is the experience, and then they feel comfortable.
Yeah,
and so then they start to ask questions.
Okay, well, so what are some of the questions that you've heard?
Same thing you just asked about. Do I need to take all 3? Do I need to take this booster? Tell me again why, you know, that kind of thing. Because, you know, people tend to think that people who are not housed aren't educated.
Oh, yep.
And that's not so.
Yeah.
Yeah. So I've met just some of the most wonderful people.
That's so funny you say that, because it's like I don't think that, but I probably discount their ability to navigate incredibly complicated systems.
Yeah.
Because even through this work, funded by MDH, I've been like trying to figure out this constellation of organizations that are there to support.
Good luck.
Okay.
Constellation is a very good word.
You try to put yourself in someone else's shoes. So you're like, okay, well, how would I find a place to sleep in a shelter? And you even presuming you've got access online. Like I'm in my office, I'm just like, it's almost like playing pretend, you know? I'm like, oh, yeah, let me navigate these websites. I'm like, well, you don't have any beds. You don't have any, okay, you say I can call after 4 and then you'll let me know. But I'm like, it's dark at 4 o'clock.
That's real. That's real. And you're using technology.
Yes. Yes.
Not everyone has that. You know, it's insightful. Yeah.
So there are some very obvious gaps. And I love that you are there receiving this information, because I know you're not keeping that information to yourself.
Of course not. Of course not. yeah. It's amazing. I've told people over the past 2.5 years that the vaccine, and my team, we always say this, the vaccine has just taken us places we would have never gone before,
Oh, yeah.
you know? And so those experiences, really and truly, as an organization for Black Nurses Rock, it has allowed us the exposure to where the
Yes.
people are that need us,
Yeah.
beyond vaccines.
Very much so.
Hmm.
So can you are you able to speak to any additional services that you know that people in the communities that you're serving need that are not currently being provided? Because this is a good opportunity to let some people know.
Yes, yes. And I say this all the time,
Mm.
if you're going to experience homelessness, Minnesota's not a bad place to be.
Okay, I will tell you what. I talk to a lot of people, and people are like, "Why would you stay in Minnesota?" People are asking me. They're like, "Jerome, why are
Yeah,
you in
why?
Minnesota?"
Yeah,
They need
yeah.
talk show hosts in Hawaii, Jerome.
Yeah. I so the resources are there. It's connecting the dots for the people.
Hmm. Hmm.
That's the challenging part because they have to first trust that you're giving them good information.
Yes.
And so that's a part of why, for me, it is now I know where they are,
Yeah.
So some of the other things that you're aware of that I'm doing, those are my target spots now.
Gotcha.
Mhm.
And we can touch just a little bit on one of the things that you've done. So I was on an email chain. Well, even just one email. And it said, support Kelly for this. And I was like, oh, yeah, whatever Kelly wants. No
Thank
problem at all.
you.
But there were so many people on that email. You are so connected. And it was like you had to vote for you.
Yeah.
Basically, it was like
Yeah.
an election,
Uh-huh.
and you won. Can you tell us a little bit about what you won?
So what I did win was a grant through the American Heart Association.
Yes.
What you voted for was the fan favorite. I didn't get that
You're
one.
kidding. I should have voted more times.
Well, let's say they didn't say I
You're
got
my
it.
favorite.
Thank you.
Yes.
Thank you. But yeah, locally and nationally, there's the Business Accelerator Program.
Okay.
And so the people in my group were from the Midwest and then Hawaii.
Oh,
And
Hawaii
so
again. How
I
funny.
know there
Yeah.
are like 6 people,
Okay.
I believe, out of Hawaii. And so, of course, it was Zoom, and we were all receiving what is considered like a mini master's in business. Oh, there was work involved, honey.
Okay.
Oh, like a lot of work. I'm running clinics, and they're like, "This is due," and I'm going like, "Really?"
Yeah.
But it was building the business
Hmm.
and understanding a lot of what's out there. And it really, allowed me to think about the next steps.
There you go.
It was mind provoking because
Yes.
sometimes we're task oriented and we're just dealing with what's in front of us.
Yep.
But the program was very insightful, learned a lot, had to deliver a speech over at General Mills. That's that was the spot. They were one of the producers
Wonderful.
and sponsors, I should say. And so, we had to do a presentation in front of a group of people.
That's fantastic.
Yeah.
Well done.
Yeah.
Clearly it went well.
Yeah, it went well. Yes, yeah. It's on YouTube, I believe.
Oh,
Yeah.
really?
Yes.
Oh, I'll link to it.
Yes. So it was really a lot of fun. And the other groups that competed, just the things that people are doing.
Yeah.
It's amazing. And I got a chance because I won for Minnesota. It was a $15,000 grant,
Congrats
which
again.
allows me to support some of the things that Black Nurses Rock will be providing in terms of preventative care.
Okay.
And there are a couple of programs that I'm supporting with that grant. But nationally, I had to compete as well. So I represented Minnesota on the national platform too for the American Heart Association. Did not win.
Okay.
But
I was about to say, is that still going? Where do I vote?
That one was tough. There are some people in this country that are doing.
Tough.
I know. But that one was again one of the grand experiences of this whole thing. Yeah. But some people are doing some phenomenal work.
Well, I am interested in exploring more of your work, especially in the area of health disparities. But if you want to plug anyone else, you certainly can because we all do better when we all do better. For now, let's take a coffee break and we'll be right back.
I don't like spinning.
Working out. It's hard when your schedule's as busy as mine.
Cooking is not my thing. It's boring. Nope.
Disgusting.
I knew I needed to make a change.
I knew we needed to make a change.
I knew I needed to make a change.
You know how I got healthier? Not cooking.
I switched up my order and I walk to and from the restaurant.
In the morning, I get my work done. At night, I put my work in.
We still don't like eating vegetables. But it turns out we kind of like drinking them.
Improve your heart health to your own beat. Live to thebeat.org.
I am a mother of 3. I'm from Puerto Rico, but been in the Midwest since 1994. I have 3 beautiful children, one a 20-year-old trying to figure out adulthood. Then I have a 14-and-a-half-year-old in Northeast Middle School. And my little one got drilled of how important it is to keep everybody safe. I suffer from type 2 diabetes, hypothyroidism, so my immune system is compromised and I'm overweight, as you can tell. So my little daughter started telling me, Mommy, please get the vaccination. I don't want you to die. You need to go to my graduation. You need to do this. And I told her, I'm going to do this for my kids. I really, at that point, to be honest with you, I was like, but I thought to myself, okay, I need to do this because all the reports and all the symptoms people are dying from, I don't want to be there. So when I got my vaccine, I was a little hesitant, but I noticed the next 3, I didn't get sick at all, no symptoms like other people have experienced. My husband said, well, I don't see any horns or any tails coming up. I guess it's safe for me to have the vaccination. She even told me one day, Mom, you realize we're part of history? And it's like, oh yeah. He says, who knows? My name might be one of those history books. I'm like, oh my God, where do you come from?
Healthcare isn't just about who treats you, who pays for it, or the innovation that makes it all work. It's about being a partner for all of it, for all of us. A partner for good.
Open up the door, 'cause I'm feeling glorious. Yeah, I'm about to win, I'm about to win. Oh, I'm gonna light this town. Oh, you're gonna see me now, 'cause I'm feeling glorious.
Welcome back to Bottomless Coffee with Jerome. We are here with Kelly Robinson of Messianic Care, and I am going to wind her up and let her talk to us about health disparities, because I know that is a passion of yours. We've alluded to it a lot of it in the previous segment, but I don't think that we've had a big picture conversation about the disparities that are at play in our country, particularly in the Black community, but you are able to speak to whatever community that you would like to.
Yeah, I view it, I sit in a different seat. And as a Black woman, I am more conscientious of people of color.
Yeah.
Because our experiences mimic across the board. And so, it's really sad to say that not a lot has changed because, and it's not that the resources are not being built. It is connecting the dots.
Yeah.
For the people. Because the thing is, they don't know what is out there and where.
Yes.
And so we've got to go to where they are. And that's been the challenge.
Yeah.
And Minnesota has tried to do a lot, and all of the homeless shelters. And I start there because, that's like the core and the mass of people
Yeah.
who, for whatever the challenges are, whether it's mental health or it is that they're new to the city, because I tell you, when we did the clinics in the shelters, I can't count a day where we did not have at least 2 to 5 people that came from across the country to Minnesota.
Oh. Okay.
And so I'm getting these calls, and it wasn't just across the country. We're talking about other places.
Yes.
If they came from Mexico or Ecuador or any of those places, we're actually researching, what they got in those countries and comparing it. And there's a lot of consultation that occurs, but those people come seeking help. And so on that level, there are clinics in those places, in the shelters. And so Minnesota's tried to do that. But again, they're tasked with the amount of people that they can serve and when they are actually there. And so connecting people to the resources. And when I think about people of color and in certain areas, we've got the Fremont Clinic, North Point Clinic on this side of town.
Okay.
And then we've got Open Cities that's in St. Paul.
Okay.
And there are a couple of others, but those are the sliding scale,
Yes. Okay.
clinics, whereas people think, well, I don't have insurance, so I'll just go to the ER
Oh, sure.
at Hennepin County Medical Center.
Oof.
When you're there.
I don't go to the ER.
I know, and it's like you're there 10 hours and,
And the bill.
Yes, and the bill.
Yes.
And so I think one of the multiple messages and things that Black Nurses Rock is tasked with is giving people that comprehension that, it's really cool to have your own doctor.
Yes.
I mean, it really is.
It is.
Because you show up, whether it's the Fremont Clinic or any of the clinics.
Yeah.
You build that relationship, and then when something goes wrong, you go to the person that knows you, because then it's not a drop in the bucket when you go to the ER. They don't know you. You show up.
Yeah.
And people get angry when they're misdiagnosed. But if you go to the same person, we treat our cars better than we treat our bodies. You know what I'm saying?
Yeah.
And so, it really is.
I'm about to go on vacation. I'm about to mess myself up.
But connecting the dot for the people, it's like, let's make it a straight path, create that relationship. Then that person knows a little bit about your health.
Yeah.
They'll look at your chart, then they get to know who you are.
Yeah.
And that's the relationship building in healthcare that I think will support diminishing health disparities.
Are the people that you're speaking to on that level receptive? Or are you able even to speak to the obstacles that they face? Are they like, well, Kelly, I would love to go to my same doctor, but,
Yeah.
it's a tough profession and they're always leaving.
Yeah. You're absolutely right.
trying to get there is a challenge.
And the key is trying to get there. And I think, so one of the things that I'm doing with one of the programs that I'm doing is we're going into the neighborhoods where the people are.
Yes.
So Rondo Library, that's where we kind of started. Everybody goes to Rondo Library in St. Paul, so it's like, if we have our meetings there, they'll come to that location.
Yeah.
In Minneapolis, we selected a church, Mount Vernon. And so that's where we had been meeting. And so now we're going to be at the Episcopalian Church, which is right behind Sammy's, right there on Emerson, I think it is.
Sure.
I think that's right.
I'll trust you.
Yeah, you know what I mean? But the key is, I think that because of the ability of people on that level to get to the resources and to keep that consistency, is we've got to go to them.
Yeah.
We've got to make it accessible. We took that vaccine bus all over the state. We did rest stops. We did, you know what I'm saying?
Yeah.
We can implement that same thing.
So I feel very appreciative of you being kind of further towards, not towards the end of someone's life, but further down in their journey, where they have already experienced a lot.
Yeah.
A lot, and they've experienced a lot of things that I, in my work, would like to prevent them from ever experiencing, so they don't get to you.
Yeah.
At least not with the whole host of concerns. Maybe one or two less than before. And so, when I'm thinking about disparities, we'll say that's where you are, and over here, I'm like, well, for Black women, this is the data that I'm looking at, and it doesn't look good.
Right.
So what can we do to change the outcomes that we're getting, right? Because the system works the way it's designed to work. So how can we change the system to get different outcomes, particularly for Black women, like yourself, like my mother, like my niece, like my aunts, you know? And I don't know, I feel guilty having fun with it, you know? I'm like, I'm gonna change some lives. It's gonna be, no one's ever gonna know that I did this. They're gonna be so happy. Well, they would be happy if they knew that it had happened. For example, in the Public Health Advisory Committee, and I probably mentioned this before, so sorry, y'all. We worked to start removing lead from our blackest, brownest, and poorest neighborhoods. Just at the city level, you know, if you go in for an inspection, if you see peeling lead paint, you know, alarms should go off in your head and say, oh yeah, some kid is gonna taste that. And then they're gonna have these impacts over their entire lives. I've got a 1911 home, and the first thing I did was test the water. I went in there and I was like, oh, there is lead. Don't drink this.
Yeah.
No one is allowed to drink this. But I looked next door, and my neighbor has 6 children who are there. You know, they've got the same lead pipe as we have, but we don't live in a neighborhood where it's the blackest, brownest, and poorest. And so the city resources aren't coming to fix our stuff. And so we got to take the onus on ourselves, not just for the cost of the infrastructure replacement, but also on the education.
Yeah.
Because if you're not educated as to what the risks are, then how are you supposed to avoid the obstacles or the circumstances that lead to those disparities?
I'm smiling because that is the key.
I thought so.
That is the key. It is. And, you know, so because it's a huge task when you talk about how do we create change in health disparities. And we've been stabbing at it for quite some time. But when we speak of women of color, that age range, 40 to 64.
Okay.
I'll speak to what's happening here in Minnesota.
Okay.
The Minnesota Department of Health has created an opportunity for women of color in that age range to be a part of a program that allows them education about their cardiac health. Now, that's just one piece.
Yeah, but an important piece.
Very important piece, because heart disease is so prevalent in Black women. And so even though that's a small chunk of the masses.
I mean, it's one of the leading causes of death.
It is.
It's pretty big.
You know what I mean? But we have so many, you know, comorbidities that's just one. And so I'm honored to be a part of deploying what that program looks like.
Oh, okay.
Yes.
Oh, can you tell us anything about it?
Yes.
Okay.
Yes.
Yay.
So I'm on my second class. And the key with this is the faith-based organizations and churches.
Okay, when you say second class, you mean like a second cohort?
Second cohort.
Okay, so not class number 2.
I see it as class. Yeah.
Second
but
group of people.
A second group of people.
Wonderful. Okay.
Yes, thank you for that.
Yeah.
So that means second group. I did 44, and now we have 32 people.
Oh my gosh.
Yes,
that's a lot of people.
because, and that's the key. People want to know.
Yeah.
But we have to tell them where they understand. And so, you know, my thing is, I know what you need, but I'm going to bring it to you culturally.
Yeah.
So let's talk about it, but let's talk about it like we're talking about our families, you know, and let's talk about how we're eating based on what you're eating right now.
I love that.
You know, let's not make it extreme where you go throw this out and do this
Yeah.
and you can't have this. Extremes don't work.
Yeah.
Because people can't comply over time. But if you incorporate small changes
Yes.
and you educate them, because you can tell them what to do, but if they don't experience it, you know how we learn. We experience things, we do them, and then it's like, oh, I can't tell you how many people. Class 1, I always pride myself in saying, you know, so who's drinking lots of water?
Oh,
you
yeah.
know, and everybody's, oh, I drink lots of water all the time, da 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 da. And when I convey that there's sodium in the water, I cannot begin to tell
what do you
you.
mean?
I know, right? And so they're like, what?
Yeah.
So there's sodium in the water? You know, it's like, yeah. So if you're taking...
How much in this water? I don't taste any of it.
You can't, because they add minerals and enhance the taste. It's written on the bottle.
Oh, bottled water.
Bottled water.
Oh, okay.
And no.
Oh,
But
dang.
you can also go to your water department's website to see what kind of filtration system that they're doing.
Okay. Tell me about the sodium in the water.
Yes. So,
like I need to be adding that to my sodium intake.
Yeah. Because, you know, we're looking at like 140 milligrams a day, which is like a teaspoon.
Oh my gosh.
Oh yeah.
So I wouldn't say I'm a health nut, but if you look at my diet, you'd be like, okay, girl. You know, I like okay, as an example, my dog got sick. And so he ate some like chicken. I just fried it in olive oil, boiled some potatoes, boiled
Feed
some.
that dog good.
I know, that's what I said. I took some. I was like, I can eat this. I was like, oh, this is delicious. I should eat like this. And I would eat that every day, and I'd be perfectly happy. If I see my husband cooking, and I'm like, why are you eating all that butter? Like, what are you doing with that? This recipe doesn't even need that. Like some people cook rice with butter. I'm like, you know. Yeah. So for me, it's a lot of removing a lot of the unnecessary stuff that my husband refers to as the taste.
But that's important because that's why people don't comply with change.
Yeah.
Because if it doesn't taste good, then they won't continue. So the education piece, the experience. So one of the things that we did with the first class, the first cohort.
Okay, you do that, and then let's remember to circle back to wine and beer.
Yes.
Go ahead.
And so one of the first things that we did was one of several things that we did. We talked about the water, of course, and you know, because most of us, including myself, I take 2 pills every day.
Oh.
Yes. I am hypertensive. Yes.
Oh, okay.
Yes. And so I'm very conscientious of what I drink because there's sodium in absolutely everything. So, you know, no name brands, but just look at the bottle. And reverse osmosis is the one that takes the sodium out.
Okay. Gotcha.
So you can buy the name brand or non, just looking for that filtration system. But one of the things that we learned about most of our participants is, you know, taste. I use salt because it makes my food taste better.
Right.
So we went to one of the spice stores.
Oh.
To share that experience. And, you know, a part of my team, it's never just me and all of what I'm doing. With the Minnesota Department of Health and the program that we're talking about, I have 2 cardiologists, actually a 3rd now, and a dietitian, and 2 nutritionists, and one of them is a chef.
I need to be in this class.
Absolutely. I know, right? But again, this is a small segment of what we can deliver to decrease those health disparities with the education.
Yes.
And so even though we have that age range, 40 to 64, I was very clear with our discussions that in the Black household, it starts at 16, you know? And so they've allowed me to bring in the family. So we have spouses that come. They may not be officially a part of the program, but they're listening and they're getting the education, because then it's not one person in the house that's educated.
Wonderful.
It is a few ears and they're remembering.
Yeah.
And then you know how it works, it's like, oh, that's not what they said. Oh, let's look at this. And and so there's that conversation, which is what's lacking. And so
It's beautiful.
yeah.
I think in my mind, I'm like, okay, this is the Black woman class, and I will just put my ear up and take what I can. I'm kind of imagining what the gay man class would be like. And that's why I was like, we'll circle back to the alcohol because because we drink too much, processing all that or dissociating from all that childhood trauma or whatever. And we've talked about that before, so we don't have to get into it now. But when you look at the calories in a glass of wine or in a non-light beer, and then so I got a trainer. And so I'm like measuring heart rate and calories, and I'm like, I drink this and I put it in my app, and I'm like, oh no. I just took away a lot of what I did today, what I paid to do. And so you become, but with that education, you do become more cognizant. Now on disparities, you mentioned you had a crazy idea, and I'm prepared to hear this idea. I've got my coffee.
So thinking outside of the box is one of the things that I pride myself in doing, and whatever I take on, and it sounds crazy to everybody else.
Yeah.
Until we're engaged in the activity and they go, well, this is fun.
Yeah.
And this might work, or it's working.
Okay.
So you're going to hear it first right here.
Okay.
So the Minnesota Department of Health.
If it's too good, we'll edit it out. I'm like, you can make some money off of that.
It's not that good.
Okay.
But I think that it's right along the lines of thinking outside the box and doing things that are sometimes natural. And so the Minnesota Department of Health has asked that we engage those who need awareness on cervical cancer.
Okay.
Breast cancer.
Okay.
And prostate cancer.
Sure.
Why not?
Why not?
And so we're looking at, how can we add that and provide exactly what we're doing now with the cardiac class.
Oh, okay.
Yes.
Okay.
And so one of my thoughts were, we are challenged with men going to the doctor and women getting, catching breast cancer very early in the process.
Okay.
So I think that if we focus a little bit more, let me try to clean this up.
Why?
I think more on how we can allow partners.
Oh, well, good. I'm glad that's where your head went, because I was like prostate cancer. Right?
Yeah, I know.
I can text some people who can do this for you.
Allow our partners to assist us on that monthly basis.
Yeah.
To check for those things, whether it is a male providing the breast exam or the female checking the testicles for anything that's abnormal.
Yeah.
I think that is, a part of what we should educate people on doing.
It's just one of those cultural things. I thought you heterosexuals were doing this already. What have you been doing all this time?
Acting scared, and thinking it's a no. And it's like, no.
I mean, that makes a lot of sense.
It does.
Like a lot. I am surprised that that's not already being done. And so very much so.
It's not encouraged. And I think that if we speak to it, that it's a bonding, it's a sharing, and it is, I'm helping you help yourself.
Yes.
Both ways.
Yeah.
Because sometimes men, you go, well, I don't know what to do to help you.
Yeah.
And women say that too about men.
Yeah.
And so I think that's just another way that we can address
this. Was not your craziest idea, but it will be the challenge will be communicating it to people.
Absolutely.
But I'm thinking memes would be fun. You can get some like infographics or whatever, but you could really have fun with it. People are going to laugh anyway.
Yeah, they are. They are, and there are a lot of other more bizarre things that are happening out there. But this is one that I think I think can help.
Very much so.
Yeah.
I would say if I were going to pitch it to the Midwest community, I'd be like, well, you could save some money. you can just check yourself. You can just.
That's right.
You don't need to go to the doctor for that. You can.
No, I'm not saying don't go to the doctor. I'm saying let's just check it regularly.
Okay.
Well,
what is regularly for the prostate? Monthly.
Yes,
okay.
yes. Most people, most women, if they are still menstruating, then that's the monthly time frame by which we check.
I think this can happen. No problem. And if you do get some fun videos, we'll run them as commercials during the coffee breaks.
You've taken it and run with it, I see.
Speaking of, let's take a quick coffee break now. Then we'll come back with Kelly Robinson of Messianic Care, and we'll chat through just some general health tips. And then we'll move on.
Excellent.
Be right back.
Bueno, pues mi nombre es Miguel Jaime, me dicen el Corre, trabajo para la raza 95.7 1400. Las cosas que me motivó o que me hizo pensar el realmente ponerme la vacuna fue el ver mucha gente cómo estaba en los hospitales, cómo los hospitales fueron subiendo con gente contagiada, infectada y sobre todo mucha gente que estaba, pues en su momento, cuando estaba la pandemia fuerte, muriendo. Incluso tomé la decisión, tanto por mí, sobre todo por mi familia, porque no quería, y lo estuve viendo también por parte de mi familia, que tuve familiares que desafortunadamente con esto de la pandemia perdí, y fue cuando entonces pensé y dije, no, pues realmente hay que vacunarnos por el bien de nosotros, el bien de nuestras familias y nuestros hijos.
Not everyone with COVID-19 will make a fast or full recovery. Some people develop long COVID. Symptoms like shortness of breath, extreme tiredness, headaches, dizziness, or other issues that happen for months or years after their COVID-19 infection. Even mild COVID-19 can lead to long COVID. We are still learning about long COVID, but care and support may be available. Find resources for patients, caregivers, healthcare providers, employers, and more at our website.
The COVID-19 Pfizer vaccine is now available to children 5 to 11 years old. The Centers for Disease Control and Prevention recommends children who are able get vaccinated. Even children can get COVID-19, and the vaccine helps provide protection to keep children healthy. COVID-19 vaccine is safe, free, and effective for children. The Pfizer vaccine for children age 5 to 11 is a smaller dose of vaccine than the Pfizer vaccine for people age 12 and older. The smaller dose is packaged differently, so you will want to go to a vaccine location that has this vaccine. COVID-19 vaccine does not cause illness. COVID-19 vaccine protects families from COVID-19. Your child will need 2 doses of COVID-19 vaccine to be fully protected. Wait 3 weeks between getting the first and second dose. Your child is fully protected 2 weeks after the second dose. Talk to a healthcare provider if you have any questions. And the MDH hotline is also available at 1-833-431-2053.
We are back with Kelly Robinson of Messianic Care. We've enjoyed a beautiful conversation, catching up, talking about disparities on the back end, on the further down end of the journey, and getting to them ahead of time. And now let's just talk about like health tips in general. You know, you caught me by surprise with the sodium in the water. So what else might we be missing? Is there something in the coffee that I need to be aware?
You know, we're back and forth with caffeine.
Okay.
You know, whether it's good, whether it's bad, you know. My thing is whatever you're intaking into your body, just do it in moderation.
I knew you were going to say moderation.
Yeah, absolutely. Yeah. You know, because I just don't like, I can't. you know.
Yeah.
I just don't like that. It's like, then I will, you know. But if you tell me, hey, you can have it, but have a little bit every now and then, you know, because there are certain things that our palate enjoys. And so.
Well, you're so nice about it. Because I think some of us coffee lovers are like rabid over our caffeine intake. And it's like having read, again, one whole book on trauma. I'm like, is this a trauma response? Why are we? Why do you have our knives out over this coffee?
So real.
So very real.
Yeah.
How about anything else in diet or exercise?
Yeah, keep it simple.
Okay.
You know, I have one participant, she hula hoops every day.
Oh, that's nice.
I know, because, you know, that's what she enjoys.
Yeah.
So keep it simple. I tell my folks, get in the mirror, or if you're in your kitchen, dance to your favorite songs. Turn that radio on and get to moving. You know? And
that's nice.
You know, and that's a form of exercise.
Did you ever see, this is a deep reference. Did you ever see Queens of Comedy?
Of course.
Okay.
Deep cut.
I don't remember the comedian who was talking about hula hoops, but she's like, shh, shh.
Yes.
And she's like, girl, put it around your neck.
That's right. Yes. I think was it some more?
That was some more.
Yeah,
that was some more. So yeah, hula hoop, that's a good workout.
It really is, because it's motion of your whole body.
Yes.
Not to mention what it does for your lymphatic system.
Oh, okay.
Yeah.
I have no idea what it does.
Yes.
But I'm glad that it helps.
There's a vibration that's occurring, you know. And yeah. But keep it simple.
Wonderful.
You know, do the things that just keep you in motion.
So we're in Minnesota.
Uh-huh.
We have these long winters. Do you have one of those like sun lamps or anything like that?
No, I don't.
Yeah, that's okay. Sure.
But my thing is I make sure that, and this is really important for me, that my bed faces the window where I can see.
Oh, yes.
You know, so that I can open the curtain and receive what I can.
Get those 10 minutes of winter light.
Yeah.
Oh, is it like right when it's coming up,
right when
before it hits the clouds?
Right. You know,
Yeah.
and we've been doing vitamin D. You know, you'll go in the stores and they're all gone. But
what do you do for your mental health? Because you work a lot.
Oh, yes. Okay, some of it we can talk about. Let's see.
It's got to be a short list. Well, you travel. You connect with family.
I do. And one of the key things for me is music. I love live music.
Okay.
So I will fly to a city for a show.
Oh, that's lovely.
Oh, yes.
Have you been to the Dakota?
Of course
I haven't been yet. I know.
Really? Are you serious?
I'm serious.
Oh, wow.
But it's like on the list of places where I'm like, I need to get
do
there.
it. Keep it simple. Just go.
Okay.
Just go. Go on a Friday night. Go one night. Because they have things every night.
Yeah.
Yeah, just go.
That was a free shout out to the Dakota.
Yes, DakotaCooks.com. Yes. But they bring the most phenomenal folks.
Yeah.
I had the experience of being there when Prince came in.
Oh my gosh.
Yeah.
We just stumbled right into this story.
I
know. Now, did Prince perform? What happened?
No. Okay,
Let
so
me sit back.
here's the deal. I didn't even see him, okay? Because Jeffrey Osborne was performing. He was working the room, and Prince went upstairs. I saw his shoes.
Okay. I bet they were fabulous.
And they were. But I saw him going up the steps, and he sat, of course, you know, where he could look and see. And then, of course, the performer, you know, worked the whole room and went over, and, you know, nothing was spoken respecting his privacy.
Yeah.
But, yeah, man, live shows. Oh, my goodness. Yes. I will fly to Atlanta.
Yeah.
Yeah.
Oh, okay. This can be a shout out. I don't even know if it's still there. The best live performance and pork chops that I had.
What a combination.
Was at Apache Cafe in Atlanta.
Yes.
It was on a Wednesday.
Yeah.
And there was a Grammy winning artist who just came up and just played.
That's the beauty.
Yeah, I was like, Did not know this was a few blocks away from my house. This is incredible.
Yeah. And they do a lot.
They do.
They do comedy, everything there. There's a Cafe 290, which was another spot where phenomenal people that are national recording artists would just pop in.
Yeah.
Locals, just love music. It's just warming to my soul. Your question was, what do I do for fun?
Yes.
That is high on my list.
Wonderful.
Yeah.
For me, a big part of that is these conversations, these wonderful conversations that I get to have with, used to be up and coming, now she's here, and she's still going. I love to ask, near the end of every conversation, is there a message or something you want to share with this audience that you want to make sure that they take away?
Yeah. So, in light of all of what we've experienced the last 2.5 years, COVID is real.
Yeah.
December 29th, there were over 5,000 cases.
Okay.
In the state of Minnesota.
Oh, no, really?
Oh, yeah.
Oh.
The week average
Yikes.
was 700.
Okay.
Daily.
Yeah.
And I may have that last one off just a bit, but when I checked, the 29th, which was yesterday.
You can Google it and it'll show you the graph.
It's 5,000.
Yeah.
700, whatever cases. And so people are still being infected.
Yeah.
Again, based on what your status is, you don't know what the response is going to be.
Yeah.
I would get protected because that's all the vaccine is. Just get the protection.
Get boosted.
Yeah.
Mask up. Spread out. Open the windows.
Yep.
Go outside if you can go outside. Okay.
And even if it is that you only wear your mask when you go into heavy populated places, do that.
You know, because, you know, if I'm not here, if I'm sick, the show does not go on.
Right.
If I hear someone coughing, I just leave.
That's a good thing. That's a good thing. And most of us, I was just on a plane. I was like, oh, I had to cough. I was like, trying not to cough because it's alarming.
Don't choke on the
It's unreal. But yeah. It's just still protect yourself.
Protect yourself.
Yep.
Wonderful. Thank you so much, Kelly. This has been fantastic. I'm excited to have you back for season 2, beginning whenever we get to it. But I'm thinking, new rug, more chairs, multiple guests.
I love it.
It's going to be great.
I love it.
Live audience.
Yay.
Yeah.
I love it.
Thank you so much.
Thank you for having me.
Yay. And thank you. I've been Jerome Evans. This is Bottomless Coffee with Jerome. You can stream our episodes at bottomlesscoffeeshow.com. See you next time.